Now to our latest special report on the state's hospital system. Part of the problem of hospital overcrowding has been attributed to delays with the National Disability Insurance Scheme. More than 100 people are currently languishing in hospital beds awaiting NDIS or aged care funding. And there are calls for state taxpayers to be reimbursed for the cost of people awaiting entry to federal schemes.
Mandy Jamieson knows the gardens of the repatriation hospital all too well. She spent 7 months here after suffering workplace injuries, awaiting NDIS funding approval.
My mental health has gone downhill so much. I find I'm losing my temper over the slightest little thing. You know, I just want to be able to go home with the supports I need.
The 59-year-old has been knocked back twice, she says, while the NDIS disputes the permanency of her injuries.
Work cover have already done all the modifications to my house, so basically all I'm asking for is a carer for 3 hours a day to help me shower, dress.
The ABC understands more than 110 people are currently in South Australian hospitals awaiting NDIS plans or approval, almost 3 times the number of patients this time last year.
It would seem that the federal government hasn't planned well when they have implemented the NDIS system, and there needs to be some improvement, and indeed they need to meet some of the costs that are experienced by the state in regards to these long stay waits in the hospital system.
Well, I'd certainly say to my Commonwealth colleagues, it's your responsibility to provide disability support services. If your failure to provide those services is causing a discharge delay, people staying in hospital unnecessarily, we need to share the responsibility.
The National Disability Insurance Agency says many of the problems existed before the scheme came into effect, and it says it's working with the state government to find a solution. But it's not just those with disabilities. Many elderly patients are kept in public hospitals for longer than needed.
What we see is just really, families in distress and being torn apart.
David Panter is a former chief executive of Adelaide's Central Hospital Network and now runs an aged care provider. He says it's also a federal problem, a shortage of suitable home care packages.
The lack of those packages does mean that there are people who are presenting to the hospital system who wouldn't have to present if they had the care at home.
He says home care is also more affordable for taxpayers. Claire Campbell, ABC News, Adelaide.